The case we are going to discuss today is a case which is going on presently. It's the tragic case of a 13-year-old girl named Jahi McMath from California who underwent a surgery, tonsillectomy, generally routine surgery, although she underwent it for other reasons. And very tragically, there were complications after the surgery, and she had a cardiac arrest. She was hooked up to breathing machines, and shortly afterwards, she was diagnosed as being brain dead. Brain death is a definition that we alluded to in another segment of the series in our discussion about Ariel Sharon. And in this segment, I'd like to discuss it just a little more. 100 or 2 years ago, if one would have sustained cardiac death and had a heart attack, the brain would have been deprived of blood flow and would have died very shortly thereafter. And the converse was also true. If you would have sustained a major stroke or trauma to the brain and the brain would have died, it would stop sending messages to your heart and to your lungs to breathe. You would no longer breathe, no oxygen would be delivered, and your heart would also stop. But now, in the 21st century, it is possible to dissociate the death of the brain and the death of the heart in ways that were never possible before. The machine which is responsible for that ability is the respirator or the life support system. What this machine does is it artificially delivers oxygen to the body. Now, while normally when the brain dies, the brain would not send messages to breathe, if oxygen is being delivered artificially, the heart can continue to beat for a period of time as long as it is provided with oxygen. So it is possible for the brain to die and the heart to continue beating for a period of time ranging from days to weeks to even longer. In the recent past, scientists and physicians have come to the conclusion that brain death, or the death of the brain alone, is equivalent to legal death, which has been accepted pretty much universally. As such, if a patient is in a hospital and is diagnosed as being brain dead, any machines can be disconnected and the death certificate can be signed. What does Jewish law have to say about this? Jewish law has addressed this issue of the definition of death not only in the 20th and the 21st century, but in previous centuries as well. There was an episode back in the 1700s and 1600s, or a culture back in the 1600s and 1700s, which was very concerned about the misdiagnosis of death. And in fact, the concern about misdiagnosis of death is really as old as death itself. But in the 1600s and 1700s, the fear was so great that people thought they would be buried alive, to such an extent that many places, many societies, many countries actually legislated that when someone was diagnosed as being dead, the body had to be kept above ground for 3 days just to confirm 100% that the body was actually dead. This presented a serious problem in Jewish law. After all, according to Jewish law, when someone is diagnosed as being dead, they have to be buried immediately. Can one delay burial for such a long period of time? Does that not violate Jewish law? This necessitated an evaluation and assessment of the diagnosis of death. Every major Jewish figure in that period of time in the 17th and 18th century weighed in on this definition and diagnosis of death. What we are seeing now is a modern iteration of that debate. Here, it has taken a different manifestation. Here we have a new diagnosis, a new definition called brain death. As we said, secular society pretty much universally accepts this definition. Jewish law, however, remains in an intense debate about whether this definition, this brain death definition, constitutes death in the eyes of Jewish law. There are clearly legal ramifications to this diagnosis. Is one obligated to bury the body? Must one pull the plug? Can a Kohen enter the room of a patient who's considered brain dead? And a whole host of other associated questions. Today, as we stand, there is no resolution within Jewish law. There remain major figures who accept the brain death definition and major figures who do not accept the brain death definition. There are major ramifications to this issue. One of the ramifications, which we will hopefully address in another segment, is transplantation. Many, if not most, of organs that are harvested from patients after death are harvested from patients who have the diagnosis of brain death. Because in this unique circumstance, The brain is not functioning, but the heart is still pumping, the patient still has a blood pressure, the patient still has a pulse, and the organs are still receiving oxygen, so they can be used for transplantation. Obviously, whether one is allowed to donate organs or not relates to whether one accepts brain death criteria or not, and this is a major halachic issue, which should be discussed on a case-by-case with a rabbinic figure. How does this relate to the Jahi McMath case? The Jahi McMath case is unique because generally secular society accepts the brain death criteria. But in this particular case, her family has decided not to accept the generally accepted definition of death and considers her to be absolutely alive. Interestingly, the law in California and in almost every state in this country, with maybe one or two exceptions, is that the hospital is fully within its rights to disconnect the respirator and to declare the patient dead. However, because of the sensitivity of the case, perhaps the malpractice issues related to the case, they did not elect to do so. And in fact, the family petitioned the court and received permission to wait a period of time to see if they could transfer the body to another location. And in fact, they were able to transfer the body to another location, and it remains to be seen how the case will evolve. Parenthetically, the definition of brain death in general, in medicine, is an absolute irrevocable diagnosis, which means that in the history of medicine, modern medicine, since the diagnosis of brain death, if the criteria are followed specifically and repeated by competent neurologists, there has never ever been a documented case in the medical literature of any individual returning to consciousness after a diagnosis of brain death. That is what the family hopes for. The family, in a certain sense, is relying on miracles, not necessarily a religious belief in the definition of death. So that is a brief synopsis of the legal issues that relate to the contemporary case of Jahi McMath. We will follow the details of this case as they evolve.
If you like that video, hit the subscribe button and notification bell below for hours of the best Jewish content online.